Hello and welcome to this video on anterior pelvic tilt, or APT. My name is Ian Locke from Thrive Personal Training, and in the next few minutes I'm going to be explaining exactly what APT is, how you know if you suffer from it, what the implications for you are if you do suffer from it, and what you can do to correct it. As you can see, I'm at home, and everything we're going to do today you can do at home with zero equipment. Our pelvis is pretty much in the middle of our bodies. It forms a junction where our legs and our spine come together and provide all the motion we need to move around. It also supports most of our body weight, as everything above our hips is supported through our pelvis when we're standing. Our pelvis is designed to be nice and level. If we have an anterior pelvic tilt, it does what the name says. So anterior means the front, pelvic is obviously the pelvis, and the tilt means that we're tilting forwards in that sort of motion. Having a level pelvis is important because as soon as one part of our body goes out of kilter, so you're tilting your pelvis forward, it means that in order to continue standing up, another part of our body has to compensate. So what tends to happen with anterior pelvic tilt is that the hips come forward, the bum goes back, we get a lot of curvature here, your shoulders go back so you get even more curvature there, and you can get some neck pain. There are also issues further down in your lower legs as well with knee stability and knees bending inwards. There are a number of ways to find out if you have anterior pelvic tilt. First on our symptoms, so do you have a lot of lower back pain, knee pain, neck pain without any underlying injury? That could be due to APT. Also, if your bum sticks out quite a lot, for example like that, you can see straight away that my hips have dropped at the front, so that's a sign of APT. Also, with that you'll also get quite a lot of curvature in the lower spine, and that's where a lot of the pain can come from. A more accurate approach to finding out if you have APT is to measure the angle of the front and the back of the hips. So if you start off, we need to find two anchor points. If you start off with the front, if you find your hip bone, the iliac crest, so press hard on your hips until you find the bone, find the top of it and follow it round towards the front, and when it drops off it will suddenly curve down, and that's one point, which is called the, if you want to look it up, the ASIS. So that's there. And then following back with your other hand, follow backwards along the iliac crest, and then when it drops off at the back, which is also where you have a couple of dimples in your back, that's called the PSIS. If you look at the differential between those two marks, if they're both at the same level, then you don't have APT. If one's lower, if the front's lower than the back, then you do have APT. It's also worthwhile checking the other side because it's not necessarily the case that both sides will be the same. Having APT means different things for different people. We already talked about the pain that you could have in your lower back or in your neck or even in your knees, but it can also have greater ramifications for people, for example, when they're exercising. So if you're a runner with APT, all of those pains could become multiplied because you're compressing your spine at an angle it's not supposed to be compressed at for any period of time. If you're a weightlifter, if you're doing squats and you've got big curvature in your spine, as you're going down in your squat, you're putting even more pressure on your spine or leaning even further forward, so that's not great. Also, if your hips are tilted forwards with APT, you'll find that your ability of your femurs and your hips to rotate properly is limited. So as you're coming down into the squat, you could find that your knees bend inwards, which again isn't great, particularly if you're carrying significant weights on your shoulders. So if you have APT and you want to do something about it, what can you do? There's three things we're going to look at. We're going to look at stretching, strengthening, and lifestyle changes. First of all, on stretching, if you think about it, if we're tilted that way, it means that the muscles on the front of your hip flexors, such as the rectus femoris, iliacus, psoas and TFL, are all going to be slightly shortened because they don't need to go through such a large range of motion. Similarly, the erector spinae in the lower back are also going to be shortened. So those muscles need to be strengthened so that you can naturally stand with your hips in a neutral position. Muscles always work in pairs, so the opposites of those muscles haven't been doing much recently, so they need to be strengthened. So that's your abs in the front need to be strengthened, and the glutes and hamstrings need to be strengthened in the back as well. So we're going to look at those exercises for strengthening and for stretching those muscles. The first stretch that we're going to do is for the hip flexors. So these are the 4 primary muscles which move your leg upwards. What I want you to do is to take a large step forwards as if you're about to do a lunge. Put your hands on your front leg, upper leg, and then keeping your front foot flat on the floor, bring yourself down, keeping your torso nice and upright, and just go as far enough down so you get a nice stretch in your front of your hip. And then you're just going to hold it there, slight bend in the back knee. What I want you to avoid doing is leaning forwards excessively, because that takes the stretch out. What I want you to focus on is coming down, body nice and torso nice and upright, and make sure that hip comes forward in a neutral position so you're not twisted as well. And then you want to hold that for 30 seconds, 30 to 60 seconds. Once you've done that, swap legs and repeat on the other side. The next stretch we're going to do is specifically for the quads, or the rectus femoris, which is a quad which goes over the hip. So for this one, I want you to lie down on your front. And then one leg at a time, bend your foot behind you and pull your foot in towards your glutes and towards your bum. And you should feel a stretch across the top of your leg, top of the front of the leg, and just hold that for 30 seconds. Slowly release, and then swap sides. You may find that one side is tighter than the other, so try to stretch both to the same degree. And relax. This final stretch, we will be stretching the lower back. For this, you'll need a sturdy chair, or if you have a Swiss ball, you can lie face down over a Swiss ball. This stretch takes a little time to kick in, so you probably need up to a minute for it to fully kick in. But what I want you to do is sit on the chair, legs wide so that your body can drop down in front, and then you're just going to let your body roll down in front while staying sat on the chair.
Don't force it. What you'll find over time is that your muscles will relax and stretch a little, and you'll just be able to drop down a little bit further. Eventually you should feel your lower spine stretching out.
Come up slowly, just make sure you're not feeling giddy before you stand up. Like I said, hold that for up to a minute. Okay, we're going to move on to strengthening exercises now. We've got an exercise which primarily targets the front abdominals, an exercise which primarily targets the glutes and hamstrings, and then one which targets both of them all together. So the first one is to target the abdominals. So if you lie down on your back with your feet close to your bum, because you've got anterior pelvic tilt, you'll find that you'll be able to slide your hand underneath your lower spine. I'm exaggerating now, but you can see that my belly is up and I can get my hand underneath. Before you do anything, what you need to do, remove your hand and then just pull your hips back and upwards towards your torso, and so that that gap underneath your spine disappears. Now, whilst that's not a natural position, we don't want a completely flat back. For this exercise we do, and your objective through this exercise is to keep your lower spine pressed into the mat. Because what you're going to do from this position, take one leg and extend it forwards, slowly, and then back. And then onto the other leg, slowly, and back. And what you'll find is that you have to engage your core to keep your hips in the right position so that your lower back is flat on the mat. It looks like an easy exercise, but it can get quite difficult. if you do find that is too easy, or over time when your core gets stronger, you can try both legs at the same time. But you can only do that if you're able to keep your lower back flat into the mat. The next exercise is to strengthen your glutes, and you may, depending on how weak you are, you may also feel it in your hamstrings. So if you lie down on the floor with your feet in line with your hips, and push your lower back into the mat, so you get rid of this gap underneath, so you correct the anterior pelvic tilt. And that's your starting and ending position. From here, in the glute bridge, what we want to do is bring our hips up, but rather than thinking about bringing your hips up, if you think about pushing your knees away from you towards the wall, it will help you keep this straight line from your hips to your shoulders. So it looks something like this. Squeeze your glutes and hold, and come down. And when you come down, you should find that you don't have any gap underneath if you've held your position. If you need to reset, reset and come up. And back down. One more. For the final exercise, we're going to do a plank, which will simultaneously work the core and also the glutes and the posterior chain. So for this, I want you to lie down with your elbows on the floor, lower arms pointing forwards, making sure that your elbows are underneath your shoulders. Come up onto your toes and form this position. What you need to be careful of is that you don't let your hips sag towards the floor or come up too high, because you'll lose the effectiveness of that. And similarly, when you're in this position, your anterior pelvic tilt will cause your lower spine to curve excessively like this. So what we want you to do is to pull your hips forwards by squeezing your core and squeeze your glutes, and then hold this for anything up to a minute. If that exercise is too difficult for you at this stage to hold for at least 20 or 30 seconds, then you can work from your knees. But that really is a less effective exercise. You really do need to work up to be able to get into this position. So we've covered the 3 stretching exercises and the 3 strengthening exercises to help correct your anterior pelvic tilt. You can do each of those exercises for 3 sets before moving on to the next exercise, and you can do the whole program at least 3 times a week. You can do it 7 times a week, that would be fantastic, and you will see results in terms of correcting your anterior pelvic tilt sooner than doing it for fewer times in a week. If you're exercising during the day as well, just do it at a different part of the day. It should take about half an hour to do, and you should see the progress after a few weeks. Remember, if you are still getting pain or things aren't correcting themselves, you're having other issues with your pelvic area or pains around your body, do go and see a physiotherapist and get a personalised approach to sorting any issues you do have. The final area I want to talk to you about is lifestyle. So we're doing all the corrective actions we need to do for that half an hour a day in terms of the stretching and the strengthening exercises, but what can you do for the other 23.5 hours of the day to help cement those good measures into your body and into your posture? If you think about it, when you're walking, your pelvic area is moving quite a lot, and that's when you'll see a lot of people with their bums sticking out. It's quite easy just to remember to tilt your pelvis forwards and walk like that. Similarly, if you're lifting in the gym or basically any exercise in the gym, pretty much any exercise in the gym, your perfect form position is always with neutral hips. So before you do any repetition, just think about resetting your hips to bring them forward. When you're sitting down in a chair, again, if you're sitting at an office chair or a dining chair, it should be fairly easy just to make sure your hips are in that neutral position. and walking up and down stairs as well. Just bring your hips forwards as you're taking each step, and all of those measures should help cement the good practices you've been putting into place with the training.